Okay, so here's the presentation on mental health and LGBTQ plus. So I'm going to talk a little bit about the prevalence of mental health disorders in LGBT populations, um, also some of the common struggles, and then also the help available and um, what can be done to help improve mental health for LGBTQ plus people, and what are some of the areas that healthcare professionals are not so good at, and how we can improve those. So this is a presentation by Heal Society, and also just a trigger warning that this presentation will talk about mental ill health as well as suicide and self-harm. And at the end, we'll have some links to some supports that you can access if you're affected by this, and you can always talk to us in the Heal Society. Um, sorry. So some of the main mental health conditions that are affecting LGBTQ plus people are low self-esteem, depression, anxiety, eating disorders, substance misuse, so may that be drugs or alcohol, self-harm and suicidal ideation. So being LGBT inherently doesn't make you have these mental health conditions, but it can put you at a higher risk of developing these conditions. And it's thought that this is because um, our community is more likely to um, experience homophobia, biphobia, transphobia, stigma and discrimination, as well as difficult experiences coming out and social isolation, exclusion, and rejection. So this can manifest in these mental health conditions um, being brought to light. So next, I'm going to talk a little bit about the prevalence of mental health conditions. First in LGB people, and then I'm going to talk a little bit about trans people and non-binary people as well. So firstly, if you look at the first figure, which has anxiety underneath, you can see that it's quite prevalent across across the different groups, with quite a staggering figure of 72% of by women being affected by anxiety, and it just seems like this is quite a lot compared to other groups who are not in the LGBT community. And then also going along to look at self-harm, this is a significant amount across all um, groups. And then life not worth living is as high as 50%, which is just really terrible when you think about it, um, because it shows that there's some problems that are not being addressed with the current support that's available, and perhaps that um, patients do not feel comfortable to share these with their healthcare providers. So a little bit about the prevalence of mental health conditions within trans people. Um, a really sad statistic with 46% of trans people thinking about taking their life. From the report I read, that was just in the last year of when the report was written, which is something needs to be done about that. And it just shows that at the moment that people aren't getting the support that they need, and this is just a massive problem. And also 20% of trans people have witnessed discriminatory views against them when they've gone to healthcare. So it's a bit of a double-edged sword that our community's having these problems, but then when they go to healthcare, that these professionals are not treating them with respect, and this is causing further problems. And as well, with 2 out of 3 trans people experiencing depression, um, it's just the figures are really high, and the impact on people's lives. This is really difficult to live with, and having that high proportion of people um is it just shows this really bad problem. Also, there's a few more statistics that I found, which again equally is worrying. With 71% experiencing anxiety, um, and 12% actually attempting to take their own life in the past year, which is really worrying that these people aren't being helped earlier or feel the need that they can't be helped earlier. And a third self-harming and 1 in 5 experiencing an eating disorder. So it just shows that all around it's not one specific mental health condition that is affecting trans people. It's multiple conditions and shows the real problem that we've got. And then again, similar statistics to LGBT people and trans people, but this for non-binary people, 70% have experienced depression, which is like a, again a really high number. And then 50% of non-binary people thought about taking their own lives, and 41% harming themselves in the last year. So again, this just highlights the problem, and it's within the different groups of the LGBTQ plus community. Um, so from the report I read, so this was the LGBT in Britain Stonewall Report 2018. It said that there needs to be a review of curriculum to ensure that healthcare professionals are fully inclusive of LGBTQ plus mental health needs. So that's within nursing schools, medical schools, any of the allied health professionals. So I think more can be done to sort of from the start to make sure that people are aware, and then also explicitly addressing the needs of LGBTQ plus people in suicide prevention, and ensuring that there is specific guidance on supporting young trans people, and then again training staff on mental health needs of LGBTQ plus people. So conversely to in medical school and nursing school, ensuring that continuity with training staff, and then also the staff that are already there. And then more inclusive patient information leaflets and resources to be developed to ensure that LGBTQ plus people are getting the same care. And then also the report had a bit about discrimination in healthcare. So lots of members of the LGBTQ plus community have experienced this unequal treatment, with a massive 17% of lesbians receiving unequal treatment. So this is mainly manifested in the following ways. So inappropriate curiosity, outing a patient to either other staff members or anyone that they didn't want their sexuality or gender to be told to, really. Negative remarks from healthcare staff, and then sort of a lack of understanding of needs, and then as well as attributing conditions to sexuality or gender. So mental health conditions being attributed to your sexuality um or gender identity has just caused this discrimination that we've been seeing. Another thing that I wanted to focus on more specifically was in talking therapies. So in treatments for mental health conditions, what LGBTQ plus people found helpful or unhelpful. So this was from reviewing a different study. So some of the most helpful things were therapists understanding the effects of homophobia, and understanding what it feels like to be at the end of a homophobic sort of attack really. Um, and also for helping patients understand internalized homophobia and sort of really having that greater understanding on homophobia and what it means to experience that. Again, it was helpful for patients for the therapy not to be focused on their sexual orientation unless the client wanted them to. So just treating patients in a holistic review, not focusing on one specific part, which is their sexuality, which may have nothing to do with their mental health condition. And also being aware of LGBTQ plus resources. So allowing to signpost to those which are more inclusive and allows for better patient care. And then some of the unhelpful things that therapists have been doing is viewing homosexuality as a disorder, attributing or presenting concerns to sexual orientation, lacking the knowledge and consequences on coming out, um, and using sort of a heterosexual frame of reference for same-sex relationship problems, as this is quite different. And then again, just in general, having homophobic views, which make client feel quite uncomfortable, and would not give the patient the correct level of care that they require. Sorry. And then, so the recommendations from the LGBT in Britain Stonewall report on discrimination is again reviewing the healthcare curriculum to ensure the teaching covers ongoing homophobic, biphobic, and transphobic language, which healthcare professionals could accidentally use to or purposely use to offend their patients, and this could cause patients undue stress and well, experience of discrimination. So making sure that the curriculum covers inappropriate language and also LGBTQ plus health needs and how is best to help people in the LGBTQ plus community. Having a zero tolerance to discrimination in healthcare and sort of that encouragement of reporting any discriminatory behaviour that you see, as well as mandatory equality, diversity, inclusion training with a specific focus on trans-specific care to sort of get the best for patients. Um, so the next slide is just a bit about some of the resources and the support available to LGBTQ plus patients. So I'm just going to show you. I'm going to have to stop screen sharing just so I can bring up the websites, but they're really good for as support um, um, for different members of the community. Uh, it's not coming up currently, so I'll go back to that at the end. But I just want, if they've got any questions, you feel free to ask them now. Again, you can contact Instagram, and there's access to support on Cardiff Intranet. So you've got the emergency support and just general support for LGBTQ plus students. If anything in this presentation has caused any upset at all, and then also to speak to your personal tutor, family, and friends as well. I'll just go get um, the websites up. They're really good. So Switchboard is a um, is a support line for anyone in the country. It's a place to sort of explore, talk, and be heard about your sexuality or gender identity. It could be just the way that a patient's feeling, or things about relationships as well. People who run it are LGBTQ plus themselves, and that's quite good. And then you've got Mind, which just has support for patients, and then LGBT Foundation and Pink Therapy. So LGBT Foundation has got a talking therapies program which can get you in touch with LGBTQ plus friendly therapists, and then Pink Therapy has a section where you can help choose a therapist which is better suited to dealing with LGBTQ plus issues. Yeah, so they're both really good websites, and this is all found on the NHS website. So yeah, I think that's all.